While I was preparing for the NCLEX exam, I was also preparing for the UK nursing exam, but I was more focused on this, right? I know nursing is the same. Nursing in the US is also the same nursing in the UK. You are a nurse, you have the same duty to care, right? Now, this is it. So this was my big interest, right? Not the UK, but I want to take the UK nursing exam, right? So I was studying so hard for this, the NCLEX exam. Right. My mindset was if I know everything about the NCLEX, it give me the ability to also pass the UK exam. Right. So all I was just looking for is information to pass the NCLEX. So I was asking myself, what is going to be tested on the NCLEX exam? So that was my mindset. What will be tested on the exam? What will be tested on the exam? That's all I was thinking. Right. Many students were looking for the program, the question bank program to get in order to pass the exam. I was not looking for this. I was looking for what information, right, will be tested on the NCLEX exam. That's what I was looking for, right? Because I believe I need those information, right, to help me pass. If I'm going to get the question bank program, how do I know the question bank is guiding me the right way? You understand? How do I know that the question bank program is guiding me the right way if I don't know what is going to be on the exam? So I don't want to be lost, right? I don't want to be lost. I want to know what is on the exam so that if I am going to use a question bank, right, I'm not going to be lost. I will be like, oh, yes, this is what the examiner wants to test. Yes, this is what the examiner wants to test. So I can guide myself through the process. But if I don't know the what, then it's going to be difficult for me. So I was looking for what will be tested. A lot of students don't even know the what, right? I'm telling you, a lot of students don't know what will be tested on the NCLEX exam, right? They only just know the question bank program to use in order to pass. That's all, because someone told them, "Oh, use this program. It help." I used it and I was able to pass. So that's just what they know. A a particular person who told them that, oh, they use this particular program so to pass, and then you automatically want to use that same program, right? That's the thing. You as well to want to use that same program. Now, this is one thing I want you to know, right? Question bank cannot help you pass if you don't know the information on the exam, right? If you don't know the information on the exam, question bank program cannot help you pass. What will help you pass, right, is not question bank. It's the information you already know. Now, let me explain so that you understand. Take for instance, you did not attend nursing school, right? You do not attend nursing school, right? You don't like nursing, you've never wanted to become a nurse, and then somebody just gave you question bank related to the NCLEX and asked you to study that question bank. Are you going to be able to understand what is in that question bank program? Obviously, no, because you don't know anything about nursing. So if you don't know anything about nursing, how can you approach a question bank program? It's not possible, right? So that is it. Every student that is going to use a question bank program already have an existing knowledge. That is the main reason why they can use the question bank, right, to study and be able to pass. So when student A is using bootcamp and student B is using bootcamp, student A pass and student B fail, it's not because bootcamp did not try to help both party, but it's because student A had sufficient knowledge that they needed in order to pass. They only just needed the bootcamp in order to show them that they can utilize that knowledge. Right. But student B don't have sufficient knowledge in order to pass. So they relied on the bootcamp information and then it was not enough for them to pass. So the ability to pass is not the program. The ability to pass is your what? Existing knowledge. So that existing knowledge can be a lot. Why? Because when you look at everything that you've studied in nursing school, you are like, so do I have to start revising all these things in order to what? Pass the NCLEX exam, right? If you are thinking like this, you understand. Now, most students think like this, oh, I just finished nursing school right now. I don't know. Do I need to revise everything? It's a lot we did in nursing school. Maybe I'm just going to just get a question bank program to just help me out. That's how most students think. Right. But guess what? It's just the same way we did everything in nursing school then. It's just like you're about to take a med-surg exam, right? You want to take a med-surg exam. There's a lot you've covered related to med-surg. But what of if you can ask your lecturer to break down the areas that is going to be tested on the exam? And then your lecturer is like, okay, I want you guys to focus on COPD. I want you guys to focus on hypertension. I want you guys to focus on MI. I want you guys to focus on any other condition. And you're like, okay, now instead of studying everything, you now have a clear focus right here. You know you are just going to focus on this. Now, at the end of the day, your anxiety level has reduced from 100% all the way to what? 50%. Because why? You now know what is on the exam. So this routine is what the NCLEX as well to use, because the NCLEX understand that any student that is done from nursing school right now will start thinking about what is going to be on the exam. Remember, we're talking about the what. NCLEX understand this. So an NCLEX know that the moment you are stuck here, you are going to be overwhelmed, you are going to be tired of the process, and it will be difficult for you to pass the exam. So NCLEX don't want it to be difficult for you to pass the exam. That is the main reason why they created the NCLEX test plan. The NCLEX test plan, the reason why they created this NCLEX test plan, so that it can be able to guide you to know what is going to be on the NCLEX exam. Simple. So if you skip this process and jump straight to getting a question bank, it means that you don't know anything for the exam. Instead, you are relying on the question bank to be able to help you pass, which there's no question bank that can help you pass. It's your existing knowledge that can help you pass. If you don't have any knowledge, you cannot pass question bank, talk less of even passing the NCLEX. Right. So that is how it works. You see, that's how it works. So you need what? An existing knowledge. Right. Nursing school, right, has given you all the knowledge you need in order to pass the NCLEX exam. Now, it's now how you show the knowledge that matters now. Right? It's not how you show that knowledge that matters. Right. Most people are all over the place because they don't even know what is going to be on the exam. So you need to know what is on the exam. That way you are clear about what you are doing. That's the main reason why you need the NCLEX test plan. Right? Because the NCLEX test plan will tell you what is going to be on the exam. Now, for students that have failed the exam, look at it. Now, when you fail your exam, you're going to see your test report, and the report is going to tell you where you had above, below, and near the passing standard. The reason why you have this information is because the NCLEX believe that you have gone through the NCLEX test plan. That's what the NCLEX believe. They believe that you have gone through this NCLEX test plan. You know the content that will be tested. So they gave you this report immediately you fail, right? For you to now see that related to those contents we told you earlier on that will be tested on the exam, see where you add above, see where you add below, see where you add near. So now the NCLEX is now like, okay, since you can have above here, it's possible for you to still have above again in your next try, but these areas that you have below near, go back to the NCLEX test plan, go back to those content and study them. These are your weak areas. So practice those areas, right, that is related to those areas you had below near, and then come back in 45 days. Be ready to pass. But let me tell you the truth so that you understand what is going on. Do you know that some students have above the passing standard without not even knowing the content on the exam? That is the main reason why when you do your first attempt, you have above the passing standard in one area. Then you do your second attempt, you have below the passing standard in that same area. And I'm like, wow, what happened? How do you manage to have above in your first attempt, then second attempt you had below? It only means that you don't understand that content. Because if you answer 1 plus 1 equal to 2 in your exam 1, and then exam 2 you also have 1 plus 1 and you are saying it's 3, it means you don't understand the content. It means you don't even know what content was tested in the first place, because the content don't change. It takes 3 years before the content would change. So if it's the same content that NCLEX is testing, right, so how is it possible for you to have above the passing standard first attempt and second attempt you have in near or below the passing standard? It means that you don't know the content that is on the exam. But the moment you know the content that is on the exam, you are going to know that let me tell you something. The moment you know the content of the exam, It's not possible for you to have above in that particular content and don't have above again. You always have above because that shows to be your strong area. So if you see your test plan and you're having above and then the next one you're having near, it means there's a big problem, right? It means that you don't know the content. So you need to focus on the content. And where are you going to get the content from? Remember the NCLEX test plan. You need that document. Right. You are going to see if you are taking the RN, you are going to see those areas, management of care, all the way to physiological adaptation. And then you will see the clinical judgment area, right, from recognizing clue all the way to evaluation. It's going to tell you if you have above, near, below the passing standard. But you want to focus on this part, the management of care all the way to physiological adaptation. If it's the PN, you have what? Your coordinated care all the way to physiological adaptation. Then clinical judgment, you have recognizing clue all the way to evaluation. But you want to focus on this part, right? To see where you are above, below, near the passing standard. If it's the REX-PN, right? For the REX-PN, you want to focus on what? REX-PN is also using management of care all the way to physiological adaptation, but REX-PN don't have case study. So yeah, this is for Canada. These two exam is for the US. NCLEX-RN, NCLEX-PN is for US. REX-PN is for Canada. They all these exams are written by the same body, which is the NCSBN. The NCSBN is the one that is writing the NCLEX-RN, the PN, the REX-PN. So they use the same format. They also maintain the same. They don't maintain the same test plan, but they make sure that the test plan they are similar. Like the test plan information on RN, PN, Rex, PN. Right. I can 100% tell you that 90% of the content they are the same. It's just little changes or related to each scope of practice. Scope of practice, I mean SOP, scope of practice. So that's all, but they are the same. So you can easily use Rex PN content to pass RN exam. You can use NCLEX PN content to pass RN exam. You can use RN content to pass PN exam. You can use RN NCLEX RN to pass Rex PN exam. That is the good thing about the test plan. So one test plan, right, don't confuse another. That's what I just want to tell you. So yeah, they are unique, but you can still use one to pass another exam right now. So back to my main thing right now, right, which is the UK exam, the US exam. Now I was studying so hard for the US exam, so I wanted to know the what. So I was like, okay, how do I know the what? I knew I need to get the NCLEX test plan because that's where the content is. If you are taking the RN, you just go under management of care session. Under management of care, you will see the list of content. NCLEX has listed everything you need to know in order to be above the passing standard under management of care. You just need to go down that document. You will start seeing the content, the category and the content listed under it. Same thing you do for other category as well. So at least for RN, PN, Rex PN, all of them all have what? 8 category. We also call it the 8 client needs as well too. Right. Management of care, safety and care, I mean safety and infection control, right? Safety and infection control, right? You have health promotion, right? Health promotion and maintenance. You have psychosocial integrity, right? You have basic care and comfort, you have pharmacology, you have reduction of risk, and you have physiological adaptation. 1, 2, 3, 4, 5, 6, 7, 8. So this same thing is what the REX-PN have. The NCLEX-RN and REX-PN maintain the same thing. But when it's the NCLEX-PN, the NCLEX-PN don't use management of care. The NCLEX-PN use coordinated care. Now for pharmacology, NCLEX RN and REX-PN test pharmacology and parenteral therapy, but NCLEX RN don't test parenteral therapy. They only focus on what? Pharmacology. You see, that's just the slight differences between the two. But at the end of the day, they test the same nursing knowledge, right? Related to the whole principle that the NCSBN want for nurses who are going to be licensed, right? Now, but the same approach that the US is using is not the same approach that UK is using. Yes, we can easily say yes, they are both nurses, but at the end of the day, the way US are testing their content is different from the way UK are testing their content, because US expect a certain kind of care from each nurses, same way UK expect a certain kind of care from each nurses. So while I was preparing for the NCLEX exam, I noticed that despite the fact I was studying the same thing here and the same thing here, the care that NCLEX wants is different from the care that UK wanted. It's just like now, take for instance for Alzheimer's disease or dementia patient, right? The way NCLEX pay attention to Alzheimer's disease is not the same way UK pay attention to these people, right? The kind of care I mean given to Alzheimer's disease or dementia patient is different from the kind of care UK gives. UK even go in depth to this population. These people are like a population in the UK whereby they give them special kind of care. Now, if you study the kind of care related to this kind of people for NCLEX, you will not be able to answer questions related to UK, despite the fact you know about Alzheimer's disease. So imagine you are on the NCLEX exam, or you are taking a particular exam. The exam is testing you on what you know, but you don't still know how to answer it. I'm telling you, if I were you, I'm going to cry, because I know that the exam is testing me related to Alzheimer's disease. If you wake me up from sleep now and you tell me what is Alzheimer's disease, Favour, I will tell you Alzheimer's disease is related to a condition that cause what? A patient to lose their short-time memory. Same with dementia as well too. I can easily be able to tell you all this, right? Now, but guess what? I know this, but the problem right now is that I know it, but I cannot now be able to use it to answer the UK exam, because the only knowledge I have is related to how US like NCLEX exam want us to know it. So but UK have special things they want to test. So since I'm missing out on this particular knowledge, I need to start learning these particular things as well too. You see where the problem is? So now, since this is a very big problem, I have to fix it, right? I have to what? To fix it. So how was I able to fix it? So I was not only knowing the what, I was knowing the how, right? Because this is what you need to fix. You need to know the what and the how. You see, that's what is missing, because it's not enough for you to know what to be tested, right? It's not enough. You also need to know how it's going to be tested. You need to know what to be tested and how it's going to be tested. That is what you want to know. So that was how I started learning. I said, oh, so this is the way NCLEX want to test for Alzheimer's disease, right? I know NCLEX will test Alzheimer's. That is what will be tested. But guess what? I still need to know the how. So I was like, oh, so this is how they will test it. Now for UK exam, I was like, oh, this is how they will test it. So that's why I always used to tell students, you need to know what will be tested and how it's going to be tested. Very important for any exam. What will be tested is the test plan. You need to know the test plan information, the content, that is the what. Now, how, you can know how only when you start seeing past questions. I mean, not question bank, past questions. Because every exam have past questions. The NCLEX-RN, they have past question. The PN has past question. The REX-PN, they have past question. The UK nursing exam also have what? Past question. Every exam have what? Past question. Now, that is how you can now start comparing the what and the how. You can start now comparing what will be tested and how it's going to be tested on the exam. You are now like, okay, what is going to be tested on the exam? And how do they test it? So now you can now say, oh, okay, yes, Alzheimer's will be tested on the exam. Okay, let me see if the past question have any question related to Alzheimer's disease. And you now go check the past question. You are now saying, oh, so this is how the examiner will test all this information. You start learning how. That was how I knew how NCLEX test related to Alzheimer's disease and how the UK exam test related to Alzheimer's disease. So that way I was able to fix my studying, what I'm studying, right? I was able to fix it up. And when I was able to fix it up, I was able to pass the NCLEX and also be able to pass the UK exam successfully. So the ability to pass any exam is knowing the what will be tested and knowing the how. What will be tested is not by getting a question bank program. That is not how you know what will be tested. What will be tested is you getting what? The NCLEX test plan, the test plan for your exam. Because the test set by the writer of the exam. Imagine getting a question bank program that was created by people that did not even write the NCLEX exam. Now, the NCLEX exam writer are the one who created this document for you to know what is going to be on the exam. So this question bank is not related to the NCLEX writer. These are just third party that write question just to look like the NCLEX for you to be able to study, practice, feel prepared or something like that. So your main focus is the NCLEX test plan that tell you the what will be tested. So when you go over audio content, like by the way, NCLEX have NCLEX RN have like in total, right? NCLEX RN have 146 content, NCLEX PN have 152 content, the Rex PN have 153 content questions, right? You start comparing each of these. When you start comparing all this content related to the past question, you are good, right? You will start saying, okay, now this is the past question right here. So how do I know what the NCLEX is testing? You are like, how do I know what the NCLEX is testing? All right, so this is what the NCLEX is having right here. So, okay, related to this content that I have on my exam. So how do I know what is the NCLEX is testing? So you go back to those content and look at the content and find out what the NCLEX is testing. That way you start getting used to the what and how they test the question. Right. So that is how you dominate the exam. Right. You want to dominate the exam. You don't want to just go on the NCLEX exam in order to joke on the exam. You want to make sure that you are able to dominate the exam successfully. So this is how I want you to do it. Now let me show you real quick on my screen how you can do it. Now I like to use the practice analysis. The reason why is because the practice analysis is a document that have every knowledge statement that you need to know for the exam. Like for this is the RN document, right? The NCLEX want you to know 338 knowledge before you take the exam, right? You can see one. Let me scroll down the document. You see one all the way to 338. You can see it right here. 1 to 338 knowledge. This is what the NCLEX wants you to know for RN. Now for PN, there's also the practice analysis as well too for PN exam. Let's go there real quick for the PN so that you can see, right? Now for the PN, look at the knowledge statement right here for the PN, right? So see, look at everything, right? PN has 280 knowledge statements. So let's go. You will see 280 knowledge statement. The NCLEX wants you to know before you take the 280. So if you know all these things, you can easily believe that you pass the exam successfully in 85 questions. Now for the Rex PN as well too, right? This is the Rex PN as well too. Now the Rex PN have 153, right? The Rex PN have 153. So let's go down. You will see that as well too. 153. You can see 153. The information you need to know for the exam. Now, so this is how I use this document, right? In order to be able to pass. Now, take for instance, let's see one of the past question. You need the past question as well too. So this is the NCLEX past question right here. So now, sometimes the one thing you want to know is this. Let me go back to my screen. Right, this is one thing you want to know. You want to know this about every exam, whether you are taking the NCLEX-RN, you are taking the NCLEX-PN, or you are taking the REX-PN. You need to know that every question is written in form of body, stem, and answer keys. Right, big key to any exam. Body, stem, answer keys. I use the same thing for NCLEX. I use this same principle for the UK exam. I try to understand the body, the stem, the answer key. Right, there's an introduction, which is the body, the stem, the examiner question, the answer key that can give you extra understanding about what the question is asking. Right, so each exam utilize this principle for any question. Right, now the body for your NCLEX exam is this that you have right here. Let me see if I can use this. Right, so this is your body, this is your stem, and this last part is the answer keys. Right. Let me go to the REX-PN. This is the REX-PN exam, right? This is the REX-PN. Let me try to push this right. Let me erase this. Now, so this is the REX-PN. This is the body. No, sorry, this is the body right here. This part, the body. And this last part is the stem. You see, but they put it together, right? But you can easily uh differentiate the body from the stem, right? So that is the same thing that apply in every exam, right? So now the body of the question always is to tell us what the examiner want to test. Right, same with the REX-PN right here. You can easily see that this question is saying the nurse has received the following information about assigned client. So we can believe that, oh, if you are receiving information about assigned client, it means that we have the answers is going to be related to 4 clients, right? Either the answer will be related to 4 clients or the answer will be related to 1 client with 4 situations, right? 4 problem. That's how NCLEX can test. The moment NCLEX is talking about assigned client, right? There's 2 ways NCLEX can test it, or the NCLEX can also test this related to delegation, whereby they will ask which patient should be delegated. So this is another way NCLEX can test it. But at the end of the day, the body is just for information purpose. You see, that's what I'm trying to tell you. The body of your question is just for information that start you to start thinking what your nursing duty in that question. That is what the body is there for. Right. You see, I had 3 ways of thinking about just that body of that question. But in order to know what is really right about that body is when you read the stem. The stem is going to give you the question related to what you just saw in the body. Now let's go back. Now you can see, now it's talking about assigned client. Now look at what the examiner is saying, because the stem is the examiner question. Now the examiner is saying the nurse should first check the client weight. So the moment they are saying check the client weight, it means that we have 4 clients and we need to check 1 client. So a particular client need immediate what? Attention. That's what a particular client needs. Immediate attention. You see? So this question on its own is already screaming what? This question is already screaming prioritization. That's what this question is screaming. Now let's go to the REX-PN, because this is the REX-PN exam, right? Let's go to REX-PN. Look at what we have right here. Prioritize the delivery of care. You can see now, if you've gone through the content, you will now find out that, oh, so yes, that is true. The NCLEX, the REX-PN exam want to test related to what? Prioritization of care. So you will never be lost on the exam. When you see that particular question, you already know how to answer it, because you know it's related to prioritization of care. Because earlier on, you should have been reading on how to what? Prioritize care. How to prioritize care. How would you know a particular client need your attention the most and something like that? You should have been reading about that. Now let us see this. Okay, this question is related to the NCLEX, right? Now look at the body of this question. It have what we call client in labor. Now, if you have gone to the RN plan, which is what will be tested on the exam, let us look for labor real quick, right? Let's look for labor real quick. You can see one thing NCLEX want to test related to labor that we can see right here is this: complication in labor. That is one. Let us say another thing NCLEX want to test. NCLEX want to test stages of labor. Right. Now, look at what this question is saying right here. You can see we have stages right here, and it's talking about labor. So we can easily believe that this question is testing us related to the stages. It's not testing us related to what? Complication. Another particular question can test related to complication, but this particular question right here is testing us to the stages. So now, if this question is the NCLEX pass question, because obviously this is an NCLEX pass question that a particular student have done on the exam before. So now look at what the knowledge statement is saying. The knowledge statement said they will test it. So since the knowledge statement said they will test it right here, so how are you going to go on the exam after reading related to stages of labor and fail the exam? It's not possible. I understand. It's not possible. So the problem is that most students know the what, but they don't know the how. So the moment you start like going back and forth comparing those questions like this to see what the examiner is testing, you will not only know that the NCLEX will test you client in labor. It's just like if I was reading the what before, I will only know that NCLEX want to test related to client in labor. But if I come on the past question and I'm not saying, oh, so this is how the NCLEX test related to client in labor. So now I now know how to position my reading. I now know what to read and what not to read. And I know what not to waste my time on. And I know how to position my reading so that it's very clear. So if it's that before I was reading client label, I never included vital sign. Now I know I need to include vital sign. If before I was not including contraction, now I know how to. I know. And now I know. Now I know I need to include contraction. You see, this is how you study, like a student that's going to pass the exam in 85 question. Right. Same for the PN as well. So now let me show you. Sometimes it might not be direct. Like okay, let me just show you something. Now look at this particular question now. Right. You can see right here. Right. Uh, let me clean this. Oh my goodness. Right. So this is the body right here. This is the stem, and then we have our answer keys. Right. Now look at the body. The nurse is assisting with the admission of a client who is scheduled for a colon resection. You see what the examiner is saying? The nurse is assisting with the admission of a client who is scheduled for colon resection. Now look at that's what the examiner is saying, right? Now, on a normal day, most of them will be thinking the NCLEX is testing related to colon resection. If that is what you are thinking, then you are wasting your time because there's no any place on the NCLEX exam that the NCLEX said it will test you related to surgery. Now, I will show you right now. Let us type surgery real quick. Let's type surgery. Let's type surgery. Right. This is surgery, right? Right. Let me go to the content. Let me go to the content. You can see there's no surgery because you can see our search result. I did not even check this. Our search result is just true, right? This is just telling you this is not related to the content. It's just telling you those people that filled up what will be tested on the exam. So this is just the employment setting of most people that filled up what should be tested on the exam. So they reached out to outpatient surgery unit and they were like, okay, what do you feel we should test students related to surgery on the exam? So that's just this that's not the content, right? Now let me do the same thing right here. Let's just put surgery. Let's see, there's no surgery in the contents. Now but guess what, now you are now like, okay, so if there's no surgery on the exam and NCLEX is putting this, so what's the NCLEX testing? Now let me show you what the NCLEX is testing. NCLEX is testing pre-operative care. Now you can see we have pre-operative care. You can see now pre-operative care is part of the content. You can see it right here. That's what NCLEX is testing. Pre-operative care, post-operative care, monitoring for complication. So now, since I know the what NCLEX want to test, now I'm like, how would the NCLEX test it? This is just exactly how. So when a lot of students are bothered about thinking about colon recession, I am not bothered about this because I know NCLEX is not testing that. Instead, NCLEX is testing something. Is either NCLEX is testing pre-op, it's just like this. Now, when I see any question that is talking about surgery, instantly I know NCLEX is either testing me related to pre-op or post-op care or monitoring for complication. I already know that's what NCLEX is testing me. So I now want to know, is this question related to pre-op, post-op complication? So that's what I want to know. So I'm not like, okay, the nurse is assisting with the admission of a client scheduled. The moment I'm seeing admission schedule, I already know this surgery has not been done. So obviously the kind of care I'll be offering right at this point will be pre-op because I cannot offer post-op care when the surgery has not been done. I cannot start monitoring for complication when the surgery has not been done. So how do I know that this question is testing me related to pre-op care, even when the NCLEX did not write pre-op care in the body of the question because there's no place that the NCLEX put pre-op care? It's because of I saw a surgical name. So because of I saw that surgical name, the surgery is not within my scope of practice because it's the doctor that will perform that procedure. So there's nothing I can do about the procedure. The only duty I have towards that client who is scheduled for that procedure is to do pre-op care. You see, this is how the NCLEX wants you to think, right? So I've been able to cover both the NCLEX-RN, right? I've been able to cover both the NCLEX-RN, the NCLEX-PN, and as well to the REX-PN so that you can be able to see how you can approach the what NCLEX is testing and how NCLEX will test it. This is very powerful. You need to know the what and the how. Most students only know the what, they don't know the how. Most students don't even know the what. Like out of 100%, 90% don't know the what, 10% know the what. And this 10%, most of them don't know the how. Now, that's why you see a lot of students struggle on the NCLEX exam. Oh, the exam is difficult. The exam is not difficult. Okay, what I did right now, do you feel the exam is difficult? If you know the what and the how? No. If you know the what, you know the how, you cannot fail. Right. So the document I was checking from is what we call the NCLEX practice analysis. Right. So the NCLEX practice analysis for RN, there's the RN, and then we have the PN. Right. We also have the practice analysis for REX-PN as well too. Right. So that's the document, because the practice analysis is it's an analysis that was done in order to let you that you are taking the exam know what you need to know for the exam. So if you don't know about this document, it means that you are going on the exam and you are gambling it. You might end up passing or failing. Remember, if a gambler, right, want to gamble, the gambler can either win or lose. So, because you passed don't mean you know everything about that exam, or you can be able to teach somebody to pass the exam. Because I've seen a particular student who passed the NCLEX exam, right? And they did not give that particular student their license. They had to take the exam again. A student who passed the exam, take the exam again and failed and did not pass again. Right. So imagine you'll be like, oh, but she passed her exam before. So she should have the ability to pass again if she happens to take the exam again. But guess what? She passed her first exam and she failed the second one. Right. Yeah, she's supposed to have been a registered nurse, but one issue or the other, license was not given. So she was forced to take the exam again. But this time around, she failed. Right. So because somebody is telling you, oh, I passed the exam, this is what you need to use, does not mean you can use the same thing and also pass. Because if somebody who passed before can fail, talk less of you that you keep failing. So you need to know what will help you out to pass. One, you need to know the content that will be on the exam. Knowing the content that will be on the exam is not question bank. You need the NCLEX test plan that will tell you what will be on the exam. Right. So you need to go through those content individually related to each category, according to what you have on your test report. And then you start comparing those contents to the NCLEX past question. So what you need next is the NCLEX past question. Then you start comparing it side by side. So when you start comparing it side by side, you can now start understanding how the NCLEX tests the what. Right? Because the what you know is the what you might know is that you know this is a gun and you can shoot it, right? It's a gun and you can shoot it. But now, if you don't know how to operate this gun, it will be useless to you. So that is the same thing. If you go on the NCLEX exam and you feel like you just know the content, trust me, you are going to see a particular question on the exam. You know what it's testing, but you don't even know how to answer it. And you are like, the question is difficult, the question is difficult. Yes, it will be difficult because you only know the what, you don't know the how. It will be difficult because you don't even know the what, you don't even know the how. So let's change our routine today, right? Let's change our routine today. So if you are preparing for the NCLEX exam now, you definitely need to know the what will be tested and the how. So you need the NCLEX test plan, right? If you are taking the RN, you need to get the document for RN, and the PN, you need to get the document, and you need the past question, the NCLEX past question as well too. So you need the past question for RN, you need the past question for PN, and if you are taking the REX-PN as well, right, you need the test plan for the REX-PN, and you need the past question as well too for the REX-PN, so that you can be able to start knowing the what, the how. So yeah, this is everything you need to know about the what and the how. I'm going to see you in my next video.